Leukemia. It's a word that strikes fear in the hearts of many. But what exactly is it? How does it affect the body? And what can be done about it? Simply put, leukemia is a cancer of the blood and bone marrow. Bone marrow, the spongy tissue inside our bones, is our body's blood cell factory, churning out red blood cells, white blood cells, and platelets. Leukemia disrupts this delicate process. In leukemia, the bone marrow produces abnormal white blood cells called leukemia cells. These rogue cells, unlike their healthy counterparts, don't fight infections effectively. Instead, they multiply rapidly, crowding out healthy blood cells and interfering with the body's ability to function properly. This can lead to a cascade of problems, including anemia, infections, and bleeding disorders. Understanding leukemia is the first step towards conquering it. It's about demystifying the disease, learning its nuances, and empowering ourselves with knowledge. The impact of leukemia extends beyond the individual, touching the lives of families and communities. It's a global health concern affecting millions worldwide. But with advancements in medical research and treatment, there's hope on the horizon. Treatments for leukemia vary depending on the type and stage of the disease. They can include chemotherapy, radiation therapy, targeted therapy, and stem cell transplants. Chemotherapy uses powerful drugs to kill leukemia cells or stop them from growing. Radiation therapy uses high-energy rays to target and destroy cancer cells. Targeted therapy focuses on specific abnormalities in cancer cells, sparing more of the healthy cells. Stem cell transplants replace damaged bone marrow with healthy stem cells, helping to restore normal blood cell production. Support systems, including family, friends, and support groups, play a crucial role in the journey of those affected by leukemia. Community efforts and fundraising are vital in supporting ongoing research and providing resources for patients and their families. Every day, researchers are making strides towards better treatments and ultimately a cure for leukemia. With continued research, education, and support, we can look forward to a future where leukemia is no longer a word that strikes fear, but one that represents hope and resilience. Leukemia is not a one-size-fits-all disease. It manifests in various forms, each with its own unique set of challenges and treatment protocols. It's a complex group of cancers with different subtypes, each with its own characteristics, prognosis, and treatment approach. This complexity requires a nuanced understanding to effectively combat the disease. Broadly, leukemia is classified based on the type of white blood cell affected and the speed of disease progression. This classification helps in tailoring the treatment to the specific needs of the patient. The first major classification is acute versus chronic. This distinction is crucial as it influences the urgency and type of treatment required. Acute leukemia progresses rapidly with symptoms appearing suddenly. Patients often require immediate and intensive treatment to manage the disease. Chronic leukemia, on the other hand, develops slowly, often with few or no symptoms in the early stages. This slow progression can sometimes lead to delayed diagnosis, but it also allows for a more measured approach to treatment. Next comes the lineage of the affected white blood cell, myeloid or lymphoid. This classification further refines the treatment strategy. Myeloid leukemia affects the myeloid cell line, which produces red blood cells, platelets, and some types of white blood cells. This type of leukemia can disrupt the production of these essential cells, leading to a range of symptoms. Lymphoid leukemia affects the lymphoid cell line, which produces lymphocytes, a type of white blood cell crucial for immune response. This can compromise the body's ability to fight infections. Understanding the different types of leukemia is crucial for determining the most effective treatment plan. Each subtype requires a tailored approach to maximize the chances of successful treatment. For instance, acute myeloid leukemia is often treated aggressively with chemotherapy. This approach aims to quickly reduce the number of leukemia cells and bring the disease into remission, while chronic lymphocytic leukemia may be managed with a watch-and-wait approach in its early stages. This strategy involves regular monitoring and only initiating treatment when necessary to avoid unnecessary side effects and maintain quality of life. In addition to chemotherapy, other treatment options include targeted therapy, which uses drugs to specifically target cancer cells without affecting normal cells. This can be particularly effective for certain subtypes of leukemia. Bone marrow transplants are another treatment option, especially for patients who do not respond to other treatments. This procedure involves replacing the diseased bone marrow with healthy marrow from a donor. Clinical trials also play a crucial role in advancing leukemia treatment. They offer patients access to new and potentially more effective therapies that are not yet widely available. Support groups and counseling can provide emotional and psychological support for patients and their families, helping them navigate the challenges of living with leukemia. Ultimately, a comprehensive approach that includes medical treatment, emotional support, and patient education is essential for managing leukemia and improving outcomes for patients. The exact causes of leukemia remain largely unknown. However, scientists believe that a complex interplay of genetic and environmental factors contributes to its development. Essentially, something goes awry in the DNA of a bone marrow cell, causing it to produce abnormal white blood cells. These genetic mutations can be inherited, meaning they are passed down from parents to children. However, in most cases, these mutations are acquired during a person's lifetime due to exposure to certain risk factors. These risk factors can include exposure to radiation, certain chemicals like benzene, and smoking. While not everyone exposed to these factors will develop leukemia, they increase the likelihood of genetic damage that could lead to the disease. Research continues to unravel the mysteries surrounding leukemia's origins, paving the way for new prevention strategies and targeted therapies. Section 4. Understanding the risk factors. While the exact causes of leukemia are complex, certain factors can increase a person's risk of developing the disease. These factors can be environmental, genetic, or related to lifestyle choices. Understanding these risk factors can help individuals make informed decisions about their health and potentially reduce their chances of developing leukemia. By being aware of these factors, people can take proactive steps to monitor their health and seek medical advice when necessary. Age is a significant risk factor for most types of leukemia. As people age, their risk of developing leukemia increases. This is particularly true for chronic forms of leukemia, which are more common in older adults. Acute leukemia, on the other hand, is more common in children, particularly acute lymphoblastic leukemia. This type of leukemia progresses rapidly and requires immediate medical attention. Chronic leukemia is more prevalent in older adults. Unlike acute leukemia, chronic leukemia progresses more slowly and may not require immediate treatment. Exposure to high doses of radiation, such as that from atomic bombs or certain medical treatments, can damage DNA and increase the risk of leukemia. This includes radiation therapy used to treat other cancers, which can sometimes lead to secondary cancers like leukemia. Similarly, exposure to certain chemicals like benzene found in gasoline and cigarette smoke is linked to an increased risk of leukemia. Benzene is a known carcinogen, and prolonged exposure can significantly elevate the risk of developing leukemia. Other risk factors include a family history of leukemia. If a close relative has been diagnosed with leukemia, the risk of developing the disease may be higher. Certain genetic disorders, like Down syndrome, also increase the risk of leukemia. Children with Down syndrome are more likely to develop acute lymphoblastic leukemia and acute myeloid leukemia. A history of chemotherapy or radiation therapy for other cancers is another risk factor. These treatments, while effective against primary cancers, can sometimes cause damage to the bone marrow, leading to leukemia. It's important to note that having one or more risk factors does not guarantee that a person will develop leukemia. It simply means they have a higher chance of developing the disease compared to the general population. Regular checkups and consultations with healthcare professionals can help manage these risks. By staying informed and vigilant, individuals can take steps to reduce their risk and ensure early detection and treatment if leukemia does develop. Awareness and proactive healthcare are key in managing the risk factors associated with leukemia. Section 5. Recognizing the warning signs. Symptoms of leukemia. Leukemia often presents with a range of symptoms, but these can be vague and easily mistaken for other, less serious conditions. Early detection is crucial for improving treatment outcomes, so it's important to be aware of the potential warning signs and seek medical attention if you experience any persistent or concerning symptoms. One of the hallmark symptoms of leukemia is fatigue, often described as extreme tiredness that doesn't improve with rest. This fatigue stems from the shortage of red blood cells, which carry oxygen throughout the body. Another common symptom is frequent infections. Leukemia cells crowd out healthy white blood cells, weakening the immune system and making it difficult for the body to fight off infections effectively. Other symptoms to watch out for include easy bruising or bleeding, pale skin, shortness of breath, unexplained weight loss, bone pain, and swollen lymph nodes. If you experience any of these symptoms, it's essential to consult a doctor to determine the underlying cause.